Okay, hello and welcome to the NAHSE CT biannual meeting and our special event. We are so excited to have you all here with us. I'm excited personally for spring and summer to be coming. So in the chat, can you share what your favorite part of spring is? Mine is tulips every year. Those are my favorite flower. Um, Today we're super excited to discuss the current political landscape and its impact on advancing health equity. Before we begin, we would like to share with you a few housekeeping items. First, the presentation will be recorded and shared on YouTube. We encourage you to keep your cameras on. Upon joining the meeting, your mics were muted. Please keep your mic muted through the duration of the discussion. Please use the chat function to ask any questions you might have or share thoughts throughout the discussion. We'd love your engagement. And finally, as a reminder, our discussion on shaping our progress takes place between now and 6:45 p.m. and is open to the public. At 6:45 p.m., we will transition to the business portion of the meeting, which is only open for NAHSE members. Moving on to our history, NAHSE's origin dates to the 1930s, but it was formally formed in 1968. Excuse me, by Mr. Everett V. Fox. And our mission is twofold. We develop executive healthcare leaders, and we push for the advancement for quality of healthcare for Black people across the country. I'm pleased to turn over the mic to Trishonda Brown, Provider Account Manager of Progeny Incorporated, Central Region, and a member of our Public Policy and Advocacy and Young Professionals Committees. And she's the host for tonight's gathering.
Well, good evening, everyone. And thank you, Miriam, for that wonderful introduction and engagement opportunity for us to talk about what we're looking forward to. As far as myself for spring, I am a flower girl as well. I don't have any particular flower I like. I like all flowers. They just give me life. So thank you for that. So welcome, everyone. It's a pleasure to be with you all this evening discussing driving impact and evolving landscape. Today, we acknowledge the current policy shifts under the new administration. As healthcare administrators, it is vital we understand the impact these shifts have on our lives professionally and personally. I feel like far too often people look at us and disconnect that we are also the patient, even though we are the healthcare professional. We are also going to address the resources available to navigate these changes. To help equip us and walk us through the discussion, I'm incredibly grateful to introduce our speakers. We have Ms. Dawn Johnson and Jai-Me Potter-Rutledge. I'll do my little clap myself. All right. So Dawn Johnson is a renowned healthcare leader, strategist, and consultant with over 30 years of experience driving transformative reform and policy. With a dual specialization in nursing and business administration, Dawn blends clinical insight with strategic business acumen. Since 2020, she has served as the president and CEO of DHJ Services, LLC, where she consults on advancing health strategy, equity, and policy. She also provides critical technical assistance to California's tribal and Indian health services, among other initiatives. She is a stakeholder for management, contracting, strategy, and development for clinical solutions that enhance outcomes while addressing business priorities. She is a multifaceted woman, if I must say so myself. She's a dedicated coach, trainer, and mentor, and supports executives and, mid-careers or new careers like ourselves in research and navigating complex policies and operational challenges. This is the really good stuff right here. Dawn was recognized as 100 Women of Color honoree in 2024 in Connecticut. Applaud that. She's also a recipient to multiple Administrator Achievement Awards, and she's a dynamic speaker, whether it's nationally or internationally. Okay. And so now we are going to highlight Jai-Me's accomplishments because we have two accomplished women here today. Jai-Me joined Brown in 2018 and worked for several years as the manager of the Diversity and Inclusion Office. In 2021, she became the director of Health Equity Scholars Program before she transitioned to the assistant dean in June of 2022. Applaud that. She has studied behavioral neuroscience and has a master's degree in healthcare administration and management. Currently, she is a doctoral candidate where she's focusing on storytelling, playing roles in racial trauma, how healthcare is assessed, health equity, and more broadly, racism in America, which directly corresponds with our discussion today. She also holds an appointment at the Albert Medical School of Brown University. She was the 2020 and 2021 recipient of prestigious Dean Excellence Teaching Award and recognized as a positive champion of learning environment at Albert Medical School. So thank you both for joining us today. It is definitely an honor. As we know, the current political administration has introduced several executive orders and policy initiatives that are influencing healthcare delivery and operations. To kick us off, can you provide an overview of key healthcare-related executive orders and their potential impact on healthcare professionals and patients? I will like Dawn to please answer that question, and then we will transition to Jai-Me.
Sure. So it's a pleasure to greet you and share my background and knowledge with you. And I just say I love Nasi. So anytime you need me, you can call me. I think where we are right now, March, was this the 24th, we have seen 97 executive orders. 97, and we are not at 90 days. And I think it is unprecedented. It is a lot to just consume, manage as you try to do your job, do the best for your patients, do the best for your facilities. So to laundry list them would be, it would probably take up all the time that we have. And so I don't want to do that because I think we can put them in boxes. And I think, we think about the impact to clinicians and hospitals with price transparency. We think about the impact to innovation and insurance programs with the cuts to research and researchers and the centers, NIH and CMS. And then we think about how it impacts policy, which impacts people and populations. So what's coming for Medicaid and Medicare. And I think globally, we think about health equity and the impact that will have on everything. And I guess I say this to my clients and my team, when I say health equity, if the first thing you think about is race, then that's part of your problem. And so I think that is how we got here. And so I think the opportunity for us in light of the 97 executive orders is to figure out what actually can be implemented. I spent 14 years in the federal government. You can make a rule. You have to interpret that rule. You then have to put that rule into some policy or practice for it to be implemented. Then you have to figure out how you're going to manage and make sure that people are in compliance with your rule. And all of that takes people. So when you cut the federal workforce, it's going to also be difficult to put 97 executive orders into place successfully to see the impact. People will act because that's what we do, we react, but we also have to be thoughtful about what we decide to change and when we decide to change it. So I know it wasn't the exact answer because I will say there are a number of executive order trackers out there. If you Google it, you can find the laundry list. There are some really nice ones that will allow you to search for different things if that's your focus. But I don't want us to get distracted by it because as clinicians, as healthcare providers, as organizations that serve communities and people, and we are those communities and we are those people, we have to be mindful of what's in the span of our control, what we need to act on and what we need to react to, and who we have to keep safe and what outcomes we still need to improve.
Wonderfully said. And I would like to echo that there's no right or wrong answer. The question is very complex and you're addressing numerous aspects of it. So thank you for that. And now, Jai-Me?
Sure. So right now I find myself in this really unique position where I'm straddling between hospital administration, so I still do that. But also I am in administration in higher education, specifically at the School of Public Health. And so I'm thinking about the implications of health in these executive orders on both of those organizations. And so one of the things that really sticks out to me is how impacted um, people, patients, our communities will be when we're thinking about NIH funding. This isn't something that, as a healthcare administrator, I oftentimes thought about when I had only had experience on the hospital side. Now that I have experience in both places, I see how interconnected they are and how impacted patients will be. So, NIH funding, for example, there is an executive order that was announced where the federal government would be reducing their indirect costs payments significantly. And so, a lot of places, hospitals included, places of research, higher education, rely on indirect costs for all types of things. And so, if those indirect costs are cut significantly, sometimes more than 50%, um, it really has an impact on the level and the quality of the research that is being done, which then influences policies, which then influences best practices and influences patients and the quality of care that they receive. And so that's one of the things that I'm paying very close attention to as a hospital administrator and a public health practitioner. Another thing that I have been paying close attention to is our exit from the World Health Organization. And so there was an executive order recently signed where the United States would be withdrawing from the World Health Organization. And that takes some time, which is something, I've been trying to make sure for myself that I'm well informed and that I'm not feeding into the chaos and the panic, but that I'm taking a step back and trying to understand the process. And so, what I learned in that process was that it actually takes some time to withdraw from the World Health Organization, almost up to a year. Um, but it will have significant impacts on not only public health, but health and healthcare. Because we wouldn't necessarily have like warnings, or we wouldn't know when the next global public health emergency is coming or where it's coming from. And so that's worrisome. And then I also think about pandemic preparedness. And so there was a lot that President Biden had put into place um, to be able to manage or properly monitor um, pandemics. And it doesn't have to be related to COVID-19, but other things. And now a lot of those things are being withdrawn. And so I think overall, when we're thinking about health and we're thinking about how we deliver health, without these certain structures in place, just overall, people are going to suffer significantly. And so those are some of the things that I'm really worried about.
Thank you, Jamie. Amazing points that we definitely need to take into consideration. I would like to summarize by stating that all aspects are interconnected from what you and Dawn are stating. Though there were 97 executive orders in 90 days, make it make sense. Um, you both provided reassurance that though there are many orders, it doesn't mean that they will be immediately implemented. There's a process in relationship to these executive orders being accessible to the American public. And taking all these factors into consideration, we need to start to pivot our thinking to global impact, especially with our withdrawal from WHO. So I would like us to leave with this and respond and don't react. Because right now there's a lot of chaos going on and we can immediately react to what we're receiving, but we just need to take time, review, and respond. All right. So now we're going to pivot into our second question, which is what are the specific actions healthcare professionals should take to adapt to these regulatory changes? So we know what's happening. What can we do as healthcare professionals to counteract that?
So it's an interesting question because foundationally, I'm a nurse, and policy for me means, research empowered it to happen. Research informed it. Research informs the price of procedures. Research informs the price of medications and whether medications get approved, or at least research used to inform it. And so as we think about our roles as clinicians, um, or individuals that serve in a clinical setting, then we have to also, I go back to the span of your control. So if the person who is in front of you is in need of care, your oath, your responsibility is to take care of it and address it. And we can write policies and still not address the need that's in front of us and still not be able to meet the inequity that happens in the system. And so if we lose sight of our role and the roles of our organization in taking care of communities and patients and one another, then what indeed are we doing as healthcare providers? We are seeking to address disparity. We're seeking to address your chief complaint. We're seeking to make you, give you a different health status or improve your health status. That's our job. And how we do it is bound by the guidelines of our organization. To the extent that the rules change those guidelines, then we have to adhere to maintain our employment and our licensure, but we also have a social responsibility. And so I think communities have always taken care of one another regardless of the rules, because that's our social responsibility. And I think we have to lean into what we know is right and how we do it. People say, well, Dawn, can I collect health equity data? And I said, well, if the data is going to help you identify the need and zero in on what you need to address, then you're collecting data that helps you refine your intervention. You can name it whatever you want to name it. So I think we need to not get caught in the cycle of the words that are sensitive to others and remember our responsibility to our community and one another.
Well said. Never lose sight of community in your healthcare mission statement, which is essentially the foundation of what we're all doing. And though there may be administrative barriers, we need to consider our social responsibility above all. All right, Jai-Me, any insight you would like to add to that?
Yeah, I think the only thing I would add is that as healthcare professionals, it's really important to stay informed, and to really push ourselves to think critically about what does transparency look like, and then what does compliance look like. And one thing that I think is really important, and something that we should prioritize is not allowing people to tell our stories for us, not allowing people to create the narrative. I think a lot about this, like when Dawn was saying, if you think about race, when you think about health equity, that's the story that folks want you to think, right? They want you to think that health equity work is only linked to race. And that's when they're telling their narrative. And so how can we better tell our stories and what's important and the work that we're actually doing? How do we explicitly state those things? And that doing that will allow us to take back some of that power when we're telling our own stories and we're telling our own narratives. So that's something that I really don't want people to lose sight of. Another thing that is just more practical, that I think that we should be doing is preparing for adjustments. How do we anticipate some of these shifts that we know are likely to come? Whether those are adjustments to Medicare, Medicaid, how are we anticipating some of those things and putting some safeguards in place? Because at the end of the day, we need to be caring for our patients, and we also need to be caring for ourselves. So how do we anticipate some of those things and try to address them in advance? How are we engaging with policymakers and advocating for patient access and quality? We always are doing those things. I think we need to continue to do those things in anticipation of some of the implications that are forthcoming. So that's all that I have to add.
I do
Not
want
at
to
all.
just,
That's a lot.
I did want to add because I think that's an excellent point. If you remember when DEI was declared the wrong term, I'll say, and we saw several titles change inside the government and external to the government. And we saw lots of individuals lose their positions that were seated inside of DEI offices, if you will. Um, that was a reaction, right? And so the title change was I need to get ahead of this and secure my position in the organization. And so as we see things come out of the White House, this administration, let's think 4 steps ahead of what impact could this have on what I do on a day-to-day basis, what my community might need from days from now, weeks from now, months from now. I tell my clients, if you believe that Medicaid is going to change, then don't roll out everything at once. Incrementally roll it out so that you are slowly weathering the storm and you have a little reserve. So I think we need to, be planful, have a plan A and a plan B, and then communicate. Like me keeping the information to myself it's only good for me. And we're a community. So if you know something, the opportunity is to share the information so that we, the royal we, can plan and ensure that there's some security happening for us. I my pet peeve is when people keep things to themselves that they know would be good for everyone else. There's enough for everyone, is what I say. So if that job is opening and you know someone may be needing that job, share the posting, put it out there because you never know what someone might need because you don't know what's happening inside some of these organizations.
Mhm.
The money is going to change, the funding is going to change, which means positions and staffing ratios and priorities will change. So think about where you sit strategically in an organization. Think if there are any strategic goals related to what you do. And if not, think about how you get closer to that strategic goal so that you have some sense of security. And if not, figure out where you need to go to get some sense of security. So just plan and communicate would be the other suggestion that I had.
I'd like to just jump into something that you said when you're talking about the sharing of information. Um, I think about how information is being filtered, like heavily filtered for us now. If you go to the CDC website, if you go to HSS website, there's a lot of things that we have relied on that we no longer have access to that impacts how we do our work, and how we think about vulnerable communities and how we think about caring for vulnerable communities. And I think there's so much knowledge collectively that we have, but we have become so reliant on these outside sources. And so, how do we start to share information internally, given all of our lived experiences and all of the data and all of the experience that we have? And how do we create something that is more sustainable, right? So, we have these wonderful relationships with the federal government, but times have changed, right? I don't think any of us could have maybe even anticipated that we would be in this position, maybe even 15 years ago. I don't think that this is something that we maybe saw coming. But how do we create a structure that does not make the communities that we care so deeply about more vulnerable? And so how do we create a way to share information that is not going to be at the mercy of the federal government and other people that are politicizing things in words like health equity or social determinants of health? How do we create something that's more sustainable is something that I think we should be thinking about.
Well said, ladies. You two are making it extremely challenging for me because you are condensing a lot of my questions into your answers, but I love it because we're getting to everything. I would like to say, in summary, it's very important for us to stay informed because some concerns really may not be applicable to us. Lean in on creating our own narratives by understanding your truth and what has been compared to what has been indoctrinated to us. Make sure we're taking proactive steps to secure our future and our community's future. Dawn gave great points in reference to your position at your job, being vigilant and mindful of any staff changes and any opportunities to grow within your community at such a sensitive time. We also have to consider we have limited resources for the truth. So if you have the truth, you have to share that knowledge amongst the community. It is extremely essential at this time. And be sure to share when you share this information, you are shifting the environment, you're shifting the culture for proactive change. So please do so. Now, a lot of the information that we touched base on so far, respectfully speaking, it can be kind of daunting because it causes chaos and fear. So I would like you two ladies to, lighten up the mood a little bit and give us two examples of policies that you may have worked on or anything that was challenging during your career that you had the opportunity to impact change.
I'm happy to go first. One of the things that I think about in Rhode Island is we recently passed a doula bill. And that was a huge success for us. So when I had a baby in 2020, actually July, like right in the middle of the pandemic. And when I first was seeking out a doula, it was not covered by insurance. It was something that was only accessible to those that could afford to have a doula. A lot of doulas had like sliding pay scales because they just really valued and understood how important the work was that they were doing. And that just didn't seem equitable. We know that especially Black moms, Black birthing people do much better when they have a doula. C-section rates are lower, all of those things, right? And so there was a huge push to say, like, how can we make this more accessible to more people? How do we make sure that doulas are valued and respected as members of the healthcare team? How do we make sure that they are being able to be reimbursed not only through state insurance, but private insurance as well? So we introduced a doula bill. And so my role really was how do I share this information with people that I can influence? I wrote a letter. There were colleagues that went down and testified at the State House, but ultimately we were able to pass the doula bill. And so once doulas are certified, they are able to charge insurance instead of people paying out of pocket. So financially, it's not a burden, a cost burden to families, and so their services are just much more accessible.
Beautiful. And Dawn?
So I have, I guess the one that really makes me the most proud is the work I'm doing now in California with the tribal and Indian health providers. So California's waiver is called CalAIM, and it's probably $1 billion waiver, Medicaid waiver. And part of the waiver is building capacity inside communities. So organizations, community-based organizations can serve their own community. And part of that work was being hired by two health plans to get two Indian health organizations, tribal providers contracted. So they have to take on the responsibilities of the managed care plan and perform their duties for their population. And in doing that, they have to have all the policies and procedures to provide, in essence, enhanced care management services. So my role was to take them in 12 weeks through the entire process and get them contracted. And if they were successful, they would get some additional funding. And it started with them not believing that I wasn't a spy for the managed care plan and asking them for information that they had yet to give the plan. And through the journey, the plan stayed on copy for all my communication. So I indeed look like a spy for the managed care plan. So part of the struggle was, how do I get them to trust me? And the trust, came when I said, if I need to fly to California and look in the box where you have all your policies and procedures, I will come to California and look in the box. If the box is on the floor, if the box has coffee stains on, I don't care how the box looks. It's not my critique. It's what I need to get started. And it took about 3 weeks. And then they sent like files upon files. And the plan said, Dawn, what did you do? And I said, I needed them to understand this wasn't a penalty situation. I wasn't there to critique them or say, you're missing all these things, but I needed to build trust with them. And now they trust me. And we've talked about what needs to happen and how they can move beyond where they are and write. I can write for them and they can edit to make it their own words and their own practice. But it was all about trust. It's like the trust that the patient has in you when you say, I'm going to do this for you, and you come back, right? Or you show back up, or you say, I'm not going to tell anyone, because there is a fear that you're going to tell their secret to someone else, and you don't tell their secret. And so for me, this trust building exercise has been present my entire clinical career, because if my patients don't trust me, then I can't make sure that their outcomes are better. They're not going to do the intervention the way I need them to do the intervention for them. And so if we are not walking through our days trying to build trust with one another and with our patients and with our teams, then we're going to be constantly behind. So I think whatever I do and whatever I've achieved, it's through building trust. And I want to drive that home. There are so many communities that mistrust our facilities because of past trauma, past actions, past things that as an organization, the brand has done to them. And until we figure out how to build trust, we will still have communities that will not come to appointments, that will not accept the truth, that will not communicate with you because of who you work for. And so, I wasn't a managed care plan person. I was the consultant they hired. But because I had that brand sitting in my email, there was no trust. So I want to just share that as you move through the world, and even as you look at some of these things and you share information, if they don't trust you, they're not going to believe what you share with them.
Very well said. And I'm just going to summarize really quick and then open up the floor to questions. I see Selena. I see Delianne. Okay. Yes. Wonderful. Sorry, love. Okay. I want to make sure we get to you too. But in summary, the question was in relationship to what actions have you two ladies taken when it's such a turbulent climate to promote change? And I will say that I'm very moved by your responses, because we're all part of NASI, the National Association of Health Service Executives, predominantly for people of color. And both of your actions were directly related to minority groups. I will say doulas, because doulas was founded predominantly for women of color, and then it transitioned to mainstream healthcare, and doulas were forgotten. The same thing with the Native Americans. They have holistic services, and we utilize them to create the foundation of the healthcare system that we have now. So it takes us as a community to come back around, like you said, never leave anyone, to share that knowledge, to allow them to access, new care, new services, to help them progress. So I think that's very beautiful. I applaud your work. It is phenomenal. And now moving forward, Miss Selena, please feel free to ask your question.
I would, but I think Delian had her hand first. So I will wait on her.
I appreciate you, Selena. Thank you. Um, I was really excited to hear all of what was shared this evening with Jai-Me. It resonates with me a lot, the work that you shared that you've done in Rhode Island with the doula services. It's a really exciting time here at Hartford Healthcare as well, which is where I am, because we are realizing also the importance of us building partnerships with doulas. So we are taking intentional actions, and I can't list them all now because it'd be too much, but we're taking intentional actions to really help in building the partnerships because we understood that there is, to some degree, a little bit of PTSD that both clinicians in the hospital setting as well as those who are doulas that they bring to the table when working together. And it didn't create usually the best environment. There were situations where, we worked really well, but then there were definite opportunities. And we found that with some of the acts that we've been taking with actual disruption of the system and creating some sustainable changes to policy and things like that, that we're starting to see improvements that are happening. So I'm really excited to hear about that. And I imagine Selena is probably going to touch on what has changed in the state of Connecticut. So I won't get on that. I'll keep it really focused on just the fact that Hartford Healthcare recognizes that this is something that needs to be done for all the reasons you name. Many of the metrics that we're looking to improve, we know that doulas impact. And for many who don't know, or for those who don't know, doulas are not clinicians, right? They are professionals that can lend support during the time of the perinatal period at any point, even if there is a loss. People don't know there's bereavement doulas or that they're interdisciplinary, but it's really exciting to hear all of what you've done, and especially towards that work.
Thank you.
And I could add to that, but my primary question was really taking it back to when we were talking about anticipating what could happen and preparing for that. Just wanted to get your thoughts briefly on how to um, differentiate between, risk assessment in the context of the changing landscape and the practices of anticipatory obedience that we are seeing, right? Because personally and professionally, I see it as a violent attack on all the trust work that many people in our roles have done to make sure people in the marginalized communities are engaging in research, are participating in their care. And all of a sudden, when you see that the entire departments are being pulled back, initiatives are being pulled back, it's almost like, call it what it is, implicit or explicit, it is violence. And it essentially dismantles the trust work that has happened. So how do you kind of begin to reconcile risk assessment strategies that are aiming to get ahead of what these executive orders will do versus, we have a social responsibility and this work has to continue, but we can't just forget about all of the efforts of the frontline workers who have done all this work to re regains trust in most communities now. So I'm really interested in where your thoughts are because I think you guys touched on that and I just wanted to drill down a little bit. If you can. Not that, we have all day, but thank you.
Sure. For me, I started off by just talking about how I straddle between two related but also very unique organizations between Brown University and Care New England Health System. Um, and I have never had as much conversation and collaboration that I have had in the past few weeks with our lawyers. And that is mostly because I am the type of person I want to push, I want to really get close to the edge, right? I want to push every boundary that I possibly can, but I also want to mitigate risk. So I don't want to not take any risk. I want to take risk, but I want to do it in a way that is well informed, that is smart, and that the organization supports. if you are in an organization where you feel supported, it's easier to do that. So, for example, at Brown, there were talks about like taking everything off the website, changing titles, and not saying that we do certain things. And our lawyers were like, no, no, no. Like, this is foundational to our mission. This is who we are as a as an organization, a higher education, Ivy League. Like, we believe in these things like deeply. So although we want to take risks, we got to take risks smart. And so nothing that we're doing is unlawful, right? We've always adhered to the law. And so how do we become more explicit about what we are doing, what we can do, and then challenge things where things need to be challenged. And so that has been my experience. So if I'm ever feeling like, ooh, I don't know if I'm going to get a slap on the wrist. I'm okay with getting a slap on the wrist, but I want to make sure that I'm being smart about it, right? And so I oftentimes talk to our Office of General Counsel or our lawyers, just to say, okay, what is the risk cost benefit ratio here? How can I reach this ultimate goal, but do it in a way that doesn't, open us up to liability? And it gets so tricky sometimes because I don't always agree, right? I just want to move ahead. I just want to go ahead and do it because I know that foundationally it's the right thing to do. And sometimes they're like, we can't do it that way, right? We're in different times. But let's think collaboratively about how we can still reach that ultimate goal. And so it's hard. It's hard sometimes, but that is oftentimes my approach, is that I want to make sure that I'm doing it in a way that is safe for me individually, but also as an organization, safe for the organization.
So I love everything you said, Jamie, and Selena. I appreciate the question. I will say when the DEI executive order came out, most of my clients have hired me for some DEI related work. And so I sat back and I said, okay, Dawn, what does this mean for you? And what I learned is we together are figuring out how we remain informed, how we remain impactful, and how we remain innovative, right? And so as people of color, we are innovative. So I yield back to that opportunity to be innovative and creative and say, we usually tape this segment that I'm on. We're going to turn the recording off when it gets to me. Because what I want is freedom for our clients to speak their truth, to say how they feel without repercussion. I'm not going to ask you to verbally confirm. I'm going to ask you to send an emoji up so I can get a sense, and you can get a sense of how many people are with you in how you feel. That's our impact. So I think as you do your risk assessment, figure out where's my opportunity to be innovative. So they say, Dawn, I can't collect only race and certain social determinant data. And I said, well, are you collecting a zip code? Right? How else can you aggregate that data to figure out where the community is and what the impact is on that community? Because if you're only collecting these very clear identifiers, broaden it, collect more data, and hone in on the things that you actually want to know about. Let's get creative and still remain focused on our goal. It is surprising and wonderful to hear from the different forums I sit in how many people are still very committed to this work in spite of what's coming. In spite of what's coming, organizations are true to their mission, as Jamie said. Organizations are repositioning their teams, but still delivering on care. And I said to a very large health system, the last time I checked, the state operations manual said you still had to provide care. If someone's preference is to not get it from someone that is of a different hue, your responsibility, you're still ultimately responsible for the care and outcomes of that individual. So you have a conversation to have, either with HR or with that patient. One of them's a little easier. So I am very direct in my counsel to them because I need them to understand lives are still at stake. That has not changed. So do your risk assessment. Remember to be very informed about what's in the box and outside the box. Remember your impact. What was the goal? And has the goal changed or how we get to the goal has changed? Right? And let's be innovative.
Wonderful. Thank you so much. So today's discussion was in reference to driving impact in a shifting landscape. And I would say the key takeaway from both of you ladies is the 3 I's. And be informed, make sure you have your impact, and be innovative. Just to dial back to the entire conversation, it's very important to stay informed in reference to all these executive orders, understand what is true, what is not, to make sure that we respond and do not react. Take time to consider your impact, maintaining relationships with your community, sharing knowledge, and be sure to think of innovative ways to continue the transformative growth within our nation as well as globally. If there's an opportunity for change within your corporation, be sure to speak up, lean on Dawn or Jai-Me for additional support, lean on any of us here at NACI for additional support. We are all working collectively for the same goal. So Dawn and Jai-Me, we are truly grateful for you leading us through this incredible discussion. It was a wealth of knowledge. You are full of so many great ideas, and I feel really motivated after speaking to both of you ladies, knowing what is possible for us. Now, I would like to transform and pivot to the members, and thank you all for joining today, for your attendance, for your engagement. It is truly valuable information that you can take. You can be the seed. You can plant the seed amongst your community and plant trees throughout to make sure everyone has access to the wealth of knowledge that we just received today. We would like to thank you all for joining today, and we are now transitioning to the business portion of the meeting.